I'm Beck, I'm 29, so I'm a mum of two. I live up here on Brisbane north side. I've worked across quite a few different fields and love nursing, and I am a country girl at heart. I ride horses, I compete, as well as I can participate a lot in the local community as well as a support worker, so very busy. I loved when I worked at Northwest Private. I worked in their surgical, medical surgical, but also I got a chance to work in their maternity unit. So I absolutely loved that, working in their maternity unit. And after I worked there, I was like, I want to find a job in a maternity unit because I just had such a great time there at Northwest Private. Coming out of high school, I had no idea what I wanted to do. Had no desire to do anything. After my oldest son, who's now 8, was born, I decided I'm going to do nursing. When I was in the hospital with him, everyone around me just seemed like they were having such a great time. They were so helpful, they were so caring, and you could see the difference that they made to people's lives and how their wealth of knowledge was able to benefit those around them. After that, I was like, this seems like a job for me. They were absolutely fantastic when I worked with them. If I wanted to work, there was generally a shift available, and it was almost always in the hospitals that I preferred and in the areas that I preferred. I worked as a cosmetic scrub scout nurse, and when I stepped up into MediServe went out of their way to find me some cosmetic surgery work, and that helped kind of broaden my experience to what I already had. Yeah, it was fantastic. They were always willing to find me the work in the areas that I preferred. I got to travel to all the different hospitals, experience all the different wards, find the areas that I loved, and found the areas I did not want to go back to. Everyone that was around me was always really supportive and fantastic. So yeah, I loved it. I quite often dealt with the Brisbane headquarters. At the time, that was Sarah. She was fantastic at being available when I needed her for anything that happened at work, before work. If I needed to let her know I was running late, she could then pass the message on to the hospitals. The after-hour teams were fantastic. If I wanted to change late notice, change my availability, or anything like that, they were always super helpful for that. I found agency nurse as the best learning experience I ever could possibly have, and I always tell people, if they have the chance, go work agency for a while. It gives you such a vast experience of all different areas, and I've never had any issues with the staff not being supportive of an agency worker. They were all, at every hospital, they were always willing to help me where I need things, and they were always really good for that. It broadens my ability to be able to manage time effectively and be able to think on my feet and not rely on others constantly. Definitely kind of encourage you to be more independent with your practice. I've worked pretty much everywhere across the floors: palliative, rehab, surgical, orthopedics, medical, dementia, aged care, cosmetic surgery, occasionally even a little bit in the paediatrics area as well. So some of the challenges is that some wards are quite heavy, and when you kind of went in, you don't really have that time to kind of learn where a lot of things are, especially on the heavy post-op wards. Yeah, absolutely. They were just fantastic with flexibility and going out of their way to kind of book the shifts in the hospitals and areas that you wanted to be in. And they were always always like willing to negotiate with the hospitals or negotiate with you start dates or start times or anything that kind of worked, so it kind of benefited everyone. So, no, I always tell people it's a fantastic learning experience. Like, get out there, go for it, just give it a go.